The National St. John Ambulance Papua New Guinea recently held an Easter morning tea to present its 2025 annual activity report. This occasion was a chance to highlight their continuous efforts across Papua New Guinea in emergency response, aeromedical retrieval, and vital first aid training. Commissioner and Chief Executive Kai Tane shared impressive statistics from 2025. The National Ambulance Operations Center handled 88,731 emergency calls via the 111 number, dispatching ambulances to over 38,000 incidents. They also trained 11,670 people throughout various first aid programs, including first aid in school, and provided resuscitation training to 35 clinicians, significantly strengthening the national health system. Tane expressed gratitude for the continued funding from the government and acknowledged provincial and city authorities for their crucial support.
In 2025, your ambulance service received 88,731 emergency calls through our National Ambulance Operations Centre via our 111 number, providing life-saving first aid advice over the phone to callers whilst we were dispatching ambulances to over 38,000 incidents nationwide. We've trained 11,670 people across PNG through our First Aid in Schools program, through workplace training and through community outreach, building awareness and life-saving capability right across the country. We've also delivered resuscitation training to 35 clinicians across PHAs, so we're directly strengthening the health system. This year is a time for us to reset as an organisation. We're on a journey of continuous improvement, and this year that journey will take on a new dimension. We're expanding our reach into Ungai Bena, into the Eastern Highlands province. Our first unit is now operational, and we're about to commence recruitment for our second ambulance in that area. This means that the Ungai Bena people are going to have 2 ambulances that they've never had before, faster emergency care, creating local jobs and real opportunities for people in the area. I'd like to acknowledge Minister Kinoka Feo for the trust he's placed in St. John to deliver those services to his constituents. We're also taking a close look this year at how we operate, making sure that every single kina of public funding that we receive is working as hard as possible for the communities that we serve. Efficiency is not about cutting corners, it's about making sure that every kina goes further and that every patient gets the best clinical care that we can possibly deliver.
Looking ahead to 2026, Commissioner Tane described it as a pivotal year for reset and continuous improvement. They are also preparing to launch a new 5-year strategy which will focus on strengthening clinical governance and expanding their capacity to align with the National Department of Health and the National Health Plan, aiming to serve more Papua New Guineans and foster growth. Commissioner Tane emphasized that ongoing support from government, private partners and the community is essential for the National St. John Ambulance to keep saving lives. He called for closer collaborations with health and emergency services and urged Parliament to pass the updated St. John Bill modernizing legislation from 1976. This, he believes, will provide a solid foundation for the service for decades to come, ensuring every person in Papua New Guinea can rely on a world-class ambulance service when they call 111.